Hi everyone. In today's clip, I will talk a little bit about Parkinson's. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Parkinson's disease, or PD, is a progressive neurodegenerative disorder that primarily impacts the parts of the brain that control movement. It's characterized by the weakening, damage, and eventual death of nerve cells or neurons in the brain, particularly those which produce a crucial chemical messenger called dopamine. The loss of dopamine disrupts the delicate balance of neurotransmitters, leading to the characteristic symptoms of this ailment. Various therapies and medications are being used to help manage and reduce the symptoms. Symptoms of Parkinson's typically worsen over time and can significantly impact a person's quality of life. They are often categorized into motor or movement related and non-motor symptoms. So primary motor symptoms are tremor, which often begins as a rhythmic shaking in one hand, foot, or jaw, especially when at rest. This can manifest as a pill rolling motion, as in like rubbing the thumb and forefingers together. It can be bradykinesia or slowed movement, which makes simple tasks difficult and can lead to shuffling gaits, reduced facial expression, which is called masked face, and difficulty with automatic movements like blinking or arm swinging while you're walking. Rigidity or muscle stiffness. Muscles remain tense and tight, causing aches, stiffness, or sometimes cogwheel rigidity, jerky movements when a limb is moved. Postural instability, problems with balance and posture. Vocal symptoms like soft monotone voice, difficulty swallowing, drooling. And then we have the non-motor symptoms, and these can often appear years before motor symptoms, and sometimes they are overlooked, like cognitive impairment, like memory problems, difficulty with planning and organization, and in some cases even dementia. Mental health disorders like depression and anxiety, sleep disorders like insomnia, restless leg syndrome, and REM, sleep behavior disorder, which is acting out dreams, pain, sensory disturbances, loss of smell, fatigue, gastrointestinal issues or constipation, for example, low blood pressure, sexual dysfunction, skin changes. Unfortunately, like many other ailments, the exact cause of Parkinson's disease is largely unknown, but it is believed to involve some environmental factors, such as exposure to certain environmental toxins like pesticides and solvents. Diagnosis is primarily based on view of medical history, symptoms, and neurological and physical examination. There's currently no definitive blood tests or imaging scans to confirm Parkinson's disease. The treatment of PD focuses on managing symptoms and improving quality of life. Treatment plans are sort of individualized and can include medications like levodopa, which is considered the most effective medication converted into dopamine in the brain. Dopamine agonists mimic the effects of dopamine in the brain, or other medication like MAO-B inhibitors, COMT inhibitors to inhibit the dopamine breakdown. Physical therapy to help improve movement, balance, and flexibility. Occupational therapy to provide practical solutions for daily tasks to maintain independence. Speech therapy to address vocal and swallowing difficulties. Exercise and physical activity, including practices like Tai Chi and yoga, which can significantly improve motor symptom and overall well-being. Massage therapy, which can help relieve muscle rigidity and tremors. Then there is deep brain stimulation, or DBS. This involves implanting electrodes in specific brain areas connected to a device that sends electrical impulses to help control movement symptoms. And this is often considered when medications are no longer sufficient. On the orthomolecular side of this ailment, there is a link to soil and dietary iodine deficiency associated with glaciation. In the studies done back in since 1920s, I should say, the relationship of iodine deficiency and this ailment has been shown up over and over again. As I have mentioned earlier, dopamine inadequacy has been shown to happen in Parkinson's as well as multiple sclerosis. The clinical study conducted in Linköping, Sweden, mentions 300 multiple sclerosis patients were treated with levodopa and tri- and tetracyclic antidepressants. After 1 or 2 months, 75% had substantial sensory motor and autonomic symptom improvements. Many also experienced the return of functions previously lost for several years. Dr. Hofer, on the orthomolecular medicine side, has suggested that in Parkinson's disease, dopamine deficiency is due to the excessive oxidation of dopamine to dopachrome. Taken as a whole, the available research literature appears to confirm this to be true. The route of treatment followed at first is with levodopa, but should be accompanied with vitamin B3 and coenzyme Q10. Vitamin B3 and CoQ10 provide protection against dopamine depletion and therefore help prevent the psychotic effects of its associated oxidative byproduct, dopachrome. This may explain Hofer's success in adding high doses of vitamin B3 and CoQ10 to the normal treatments for Parkinson's. Secondly, there is the depletion of the enzymes which protect against oxidative stress. Superoxide dismutase, glutathione, peroxidase, and catalase. As well as antioxidant supplementation, especially selenium, vitamin E, and C, is very, very much recommended. Metaphysically and emotionally speaking, we can look into emotional trauma or fear of breaking society's rules, conditions, and myths, fear of social rejection, perception of being humiliated in a social environment. In the stress of not getting what you want, you revert back to the reptilian stage of evolution, which means the destruction of the basal ganglia, resulting in decreased motor control. Now, self-righteousness persona hiding the self-wrongness persona. Fear in sort of not believing in what you do and say. The muscle tremor is a reaction to the guilt of not understanding that what you teach is what you need to learn, basically. Hope this has been helpful. Like and follow for more. Be the light.